Hello everyone, my name is Jennifer Terri. I make Philippine Travel Updates flashed on your screen. Public Health Advisory. Monkeypox. Well, monkeypox, we've heard of it 2 or 3 months ago. I think you've heard it. We've talked about it before. Not so good news. The WHO, the World Health Organization, today declared monkeypox a global health emergency. How serious can that be, Jennifer? Well, the last time the WHO issued a global health emergency was in January 2020 in response to COVID-19 outbreak. Well, the first question in our minds, will this become another COVID-19, another pandemic? I don't know. Let's talk about it more. Why is this happening? Various countries in Europe as well as Canada, US, and the UK have reported cases of monkeypox. It's a virus that manifests among others as lesions of the skin, not unlike chickenpox. So it's a relative of chickenpox po. It looks like this. Yeah. It's very recognizable. Look. Looks like big warts then. According to Dr. Edsel Salvania of the IATF, an infectious disease expert, monkeypox is easily transmitted through direct contact. With intact skin, mababa ang risk, pero kung mucous membrane like bibig or mata, pwede. There are experts considering that the possibility that the new cases may be sexually transmitted. In fact, the WHO mentioned that the outbreak is concentrated among men who have sex with men, especially those with multiple sexual partners. I'm hoping there is enough education on this. More information will be found. And people are careful with their reaction. Discrimination can be worse than the virus. Well, there are now more than 14,000 cases of monkeypox from 71 countries in the world. No, this is, I mean, in Africa po, it has been endemic for quite a while na. But it's spread out throughout the world and there is no epidemiological links to travel. Well, at least, hindi siya related to travel. So, the experts are wondering why it's spreading all throughout the world, no? Well, in other countries, in our neighboring countries, it was already found in Thailand. Nasa Thailand na po ang monkeypox. They found a case there. In Singapore, they reported a third local case of monkeypox. India also confirmed their first case of monkeypox. How about the Philippines? We have no confirmed case of monkeypox yet, according to the Department of Health. According to Dr. Edsel Salvania, there aren't any cases of monkeypox in the Philippines yet, and we haven't closed our borders. That sounds scary. But the country has begun implementing stricter health screenings and heightened surveillance and border controls. What is this? Has there any been travel restrictions? No. Wala pa pong travel restrictions na in-announce. Wala pa po and hopefully walang i-announce. Heightened surveillance, yes. The BOQ has been instructed to intensify its surveillance of passengers coming from countries with known cases. So that would be Central and West Africa, and I'm sure Europe would be a continent that they would be looking at, especially that they have reported thousands of cases na po. If you can see it in One Health Pass, there is already an health advisory issued there in One Health Pass. It states the symptoms, guys, watch out for symptoms: headache, fever, pain in muscles, back pain, lack of energy, swelling of the lymph nodes or glands. Ayan po. If you have been exposed, if you have these symptoms, please go to your doctor po. Have yourself checked before you travel to the Philippines. You can expect that there will be a stricter surveillance at the airport po. Of course, people will be looking at fever, symptoms on your skin, mga skin lesions, rashes, things like that. The WHO said that the global risk is moderate, but the threat is high in Europe. Mm. But the good thing is, there are already effective treatments and vaccines for monkeypox. However, they are in short supply. Again, meron na pong bakuna sa monkeypox. This is not a new disease. No, it's existing. It's existing and there are already vaccines to it. The smallpox vaccine is about 85% effective against monkeypox. So, hindi kagaya sa COVID na we had to wait for many months before nagkaroon ng vaccine. No, monkeypox po, there is already an existing vaccine for smallpox, which is 85% effective na siya for monkeypox. And this call or the label of putting it into a public health emergency of international concern, it's actually a good move po. It's designed to sound an alarm that a coordinated international response is needed and could unlock funding and global efforts for sharing of vaccines and treatments. So, ibig sabihin po, yung mga countries, they will work together para mag-share ng vaccines, studies, treatments. Magandang bagay po yan para as early as possible, maiwasan maging pandemic or mas lumala itong pagkalat ng monkeypox. Ayan po. So, I don't think we should panic. No, it's not the time to panic. And people who are traveling, anak ko, I understand. If you're traveling soon or if you've already booked your ticket, you've made plans, and you're worried, oh my goodness, will this monkeypox again reintroduce restrictions, quarantine, testing? We don't know yet. Let's look at other countries. Kung anong gagawin nila, yan din ang gagawin ng Pilipinas, most likely, no? The Philippines, most of the time, we just follow what other countries do. So, let's study what other countries are doing. Let's be updated with news po all around the world on what happens with this monkeypox and how it will move forward. But as for me personally, I think I agree with Dr. Dhruv of America. He said monkeypox is unlikely to cause a pandemic on the scale of COVID-19. Sabi niya malabong maging COVID-19 ito, maging ganun kalala. The virus is far more forgiving than the COVID-19, less transmissible, readily subdued by existing vaccines. Hindi siya mas nakakahawa like COVID at meron ng mga vaccine po dito. But if we don't act swiftly, forcefully, and globally, monkeypox may take hold permanently in any number of countries. Ayan. Especially to countries like, mahirap na countries like Africa. For now, what we can do is stay updated with the news, government announcements, take care of ourselves, and yun lang naman magagawa natin po. Listen to the news, government announcements. Sometimes you listen to too much news, it gives you stress, News always leans to negative news, negative. So, choose what you want to hear para hindi ka ma-stress. That's all I can share, guys. And that's all I know. That's all I can share for right now. Right now, wag magpanic. Makinig sa news and take care of yourselves. Yun lang po. Sana hindi, we're all praying that this does not become another pandemic. We're already suffering economically pa. Dumagdag pa to. Sana wag na maging malala pa. Sana maagapan at an early stage. Praying that this doesn't become another COVID-19. Let's pray together and take care of ourselves. That's all for this video po. That's all I can share. Don't panic. Wala pang mga restriction, wala pang ganon. Hindi pa ganon, guys. So God bless you all po and let's all pray together.